Is Invisalign First just a smaller version of Invisalign? Not exactly. Invisalign First is specifically designed for kids and not for adults. So if you're a parent watching for your child, whether you need to choose an Invisalign or Invisalign First, this video is for you, and I hope at the end of this video your mind will be clear to make the decision that what's best for your child. So let's get started and dive right into the video. Hi, I'm Dr. Salman Khan. Thank you so much, guys, for coming back to my YouTube channel. I talk about any of the dental and orthodontic advices week on week. So don't forget to subscribe to my channel. It will help me motivate and show up every week only for you guys. Real, honest advice, no marketing talk. So before I start explaining to you what is Invisalign First, let me first tell that how in any way I am an authoritative figure for this. I have done Invisalign about close to 300 plus cases. I've done a lot of Invisalign First cases. I've been practicing Invisalign for the last 9 years. I'm a certified Invisalign provider and I'm an orthodontist practicing for the last 15 years. So I think with some experience that I have, I can make this confusion clear. So this video, I'll break it down into 4 different parts. Number 1, what is Invisalign First? Number 2, what is the difference between Invisalign First and regular Invisalign? Number 3, what are the key features explained? And number 4, which one should you choose for your child? So without further ado, let's jump into the video. So Invisalign First is designed only for kids. The minimum requirement that we need to have when we are selecting a case is the child must have at least 2 to 3 milk teeth in his mouth when we are doing Invisalign First. That's the eligibility criteria. If your child is already having all the milk tooth gone and only permanent teeth, then we cannot do Invisalign First. Why? Because Invisalign First, a product by Invisalign, has been designed specifically for kids between the age of 6 to 11. And that, whether you're eligible or not, leave it to the orthodontist. If he's doing Invisalign First, you can just walk in and he will make an assessment and decide and let you know if your child is eligible for Invisalign First. What does Invisalign First do? It does early intervention phase 1 treatment. In case you are not sure about that, I have already made a video explaining about Invisalign First and you can go through it. So what happens in Invisalign First? They do phase 1 treatment. It helps expand the jaw, it helps modulate the jaw, it helps correct crowding, it helps breaking habits. All of this phase 1 intervention, minimally invasive, without extracting any permanent teeth, is carried out in Invisalign First treatment. Now coming to Invisalign regular treatment, this is available for children as well as adults, but whether your child requires an Invisalign First, that is phase 1 intervention, or a direct phase 2, that is for your orthodontist to decide. So I would suggest you go to your orthodontist and let him decide. So Invisalign regular ones, they do not deal with expanding the jaw and correcting the malocclusions in the same way that the Invisalign First does, because in Invisalign First there are something called as eruption tabs and distal terminal ends on Invisalign molar attachments. So what happens is these are specific features put on Invisalign First aligners that help the growing child to develop the permanent teeth coming in the right position. But an Invisalign regular one works towards all the permanent teeth already erupted and getting them into position. I hope I have not confused you. I've tried to put it as simple as possible. Generally, Invisalign First treatment phase 1 can take, let's say, about anywhere between 6 months to about 18 months, and Invisalign comprehensive or Invisalign regulars can take starting at 7 to 8 months and go up to 5 years depending on the complexity of the treatment. The purpose of Invisalign First is phase 1, like I said, jaw modulation, growth and everything, and purpose of Invisalign regular is to ensure that we complete the full treatment. In phase 1 we do it only in a combination of baby teeth and adult teeth, but in regular Invisalign we do it only on permanent teeth. So basically the goal of Invisalign First is to simplify phase 2 treatment or altogether eliminate phase 2 treatment, whereas goal of Invisalign regular is to ensure that the phase 2 treatment, or if you have not started early, to make sure from here onwards what best can be done to make a perfect smile. So when to choose which? You must choose Invisalign First if your child has multiple baby teeth and your child is aged between 6 and 11 and your orthodontist assesses and tells that it can be a part of phase 1 treatment. We can correct some problems early and he qualifies for it. But if your child is already 11 or 12 years plus and all the baby teeth are already shed and he's got only permanent teeth, or if you're an adult, then Invisalign regular is the way to go for you. So while both use the same SmartTrack material for their Invisalign clear aligners, they both have different goals and purposes. And if you're an adult and you're watching this video wondering, okay, let me just go for Invisalign instead of Invisalign First, you may get more confused thinking about what is this essentials by Invisalign. If you've done some research or somewhere you've come across, because I have had some patients who walked in from different clinics saying that, yes, I wore Invisalign. And then when I ask them, can I see? They show me a box of Essentials by Invisalign. So in my next video, I'm going to break down the difference between Essentials by Invisalign versus Invisalign and which one is the right one for you. So stay tuned. I hope you loved my content. Do consider subscribing to my channel and share this with parents to pass them this useful information. Until next video, goodbye.